Hello friends, welcome back to my YouTube channel. Today I'm going to discuss about the morphology of permanent maxillary central incisor. Okay, this is the most important tooth in our oral cavity. Okay, so I'll tell you in a brief the morphology of this maxillary central incisors. So introduction is like it is the largest of incisors. Okay, the key tooth of the maxillary arch. This is also known as the key tooth of the maxillary arch. Okay, it usually erupt between the age of 7 to 8 years. Then this is widest mesodistally. Okay, in mesodistally it is widest, okay, among all the incisors. Okay, perform cutting functions in the mastication. This teeth is used for cutting and mastication also. Okay, main importantly it is for the aesthetic role. Okay, because it is a front tooth. Okay, so crown features, how do the crown here look like? Okay, so first coming to the labial aspect, how the labial aspect matlab the front side of the tooth. Okay, how it look. Crown is a crown roughly trapezoidal or rectangular in shape. Okay, it will be rectangular in shape. Okay, mesio-incisal angle is sharp, it's almost about to 90 degree. Okay, disto-incisal angle is more rounded. Okay, and the labial surface is smooth and convex. The labial surface will be the smooth and the convex. Okay, distal side will be the rounded. Okay, it is mesial, it is 90 degree. Okay, this tooth will be visible as in the rectangular form. Okay, so there will be two developmental grooves. Okay, mamelon visible on the newly erupted tooth. Okay, then widest mesodistal dimension among all the anterior tooth, as I told you earlier. Okay, so this is the how it will be seeing. Okay, you can see the developmental grooves. Okay, mesial and distally. So distal lobe you can see, central lobe incisor. Okay, cervical line also you can appreciate in this picture. Okay, this is how the front side of the tooth of the central incisors look like, permanent wala. So next is lingual aspect. So how the lingual aspect on the back side of the tooth. Okay, palatal size. Okay, shows as well developed cingulum. There will be a prominence called cingulum. Okay, so mesial distal marginal ridges are present. Okay, lingual fossa broad and shallow. The fossa will be the broad and the shallow. Okay, possibly lingogingival grooves are maybe mostly you can see. Okay, so this is how the backside of the tooth is seen. So here you can see the cingulum and the lingual fossa also you can appreciate. Okay, then marginal ridge you can see, incisal ridge you can see here. Okay, root conventionally lingually it will be little bit lingual side. Okay, so next is mesial aspect. How do the mesial side of the tooth will look like? Okay, as I told you earlier, it is 90 degree. Okay, crown is triangular in shape. Okay, incisal edge lies on the long axis of the tooth. Okay, so greatest curvature of CEJ among all the tooth. Here the CEJ is most of, well, it is the greatest one. Okay, about 3.5 mm you can see, appreciate here. So here you can see the labial aspect of the tooth. Okay, this is how the labial side of the tooth look like. Okay, convex labial outline you can see, then mesial contact area you can see here, root apex is literally labial you can see. Okay, then you can appreciate the cervical and curvature you can see. Okay, so this is how the it will look like. Okay, mesial aspect. So next coming to the distal aspect, how the distal side, it will be most similar to the mesial aspect, but here it will be the distal angle, it will be little bit curvature. Okay, so CEJ is less compared to mesial. Here little bit curvature, CEJ you can see little bit only. Okay, contact area you can see. Okay, so this is how the distal side of the tooth is seen. So next is incisal aspect. The front, like the incisal aspect, how it will be in triangular outline. It will be shows maximum mesodistal width. Okay, here the mesodistal width will be seen most probably. Okay, lingual portion is narrow than labial. Here the lingual portion is bit narrower than the labial surface of the tooth. Okay, so here this is how the lingual aspect of the tooth is seen. Here you can see it. Okay, lingual fossa also you can appreciate a little bit, cingulum you can appreciate from the incisal aspect. Okay, so it will be in triangular form as I told you. Okay, so next this is how the incisal view it is seen. Okay, right and left both I have mentioned here. central incisor. So how, what will be the root morphology? Single, conical and straight root. Here it will be single rooted, root will be cylindrical, little bit blunt apex will be, you can see. The length of the tooth will be around 13 mm, okay, longer than the crown, okay. Cross section is triangle at the cervical third, become round at the apex. In the when you do the cross section of the incisors, you can see the triangle at the cervical third, and in the lower, like in the round aspect, you can see in the apex area, okay. So how do the pulp here look like? So pulp chamber follow external tooth shape, okay, external tooth shape you can see, okay. So one root canal will be there, only one single canal is there, okay. The pulp chamber broadly mesiodistally, okay, broad mesiodistally, okay. Pulp on mesial, it will be towards the mesial side, and it will be in central distal, okay. This is how the it will look like, okay. Triangle you have to do, okay, when doing the crown axis opening of the tooth, you have to be crown, you have to know this area how it look like, okay. So in the, here you can see the cervical, how the pulp look. Mid root it will be getting narrower, okay. This is how the pulp horn will be moves to the mesial side, and distal side also how pulp horn is present, okay. This is how the unique, what are the unique feature of this tooth is widest. As I told you, it is the most widest tooth. Mesial incisal angle is sharp, and show maximum CEJ curvature. You can see cingulum is slightly distally, so little bit slightly it will be distally, okay. Has characteristic triangular in shape. Root section at the cervical region, okay. So what are the clinical condition you have to see for central incisors is trauma prone. Here any injury of the front teeth or accident, here trauma, this is the first tooth which will get the traumatized, okay. Common site for developing anomalies, okay. It is the most common site, like you can see the talons curbs, cusp, the important aesthetic restoration and smile design, here you can check for it. And then chronology, how when and the premolars are getting erupted, okay. Initial classification begins at the 3 to 4 months of age, okay. Crown preparation 4 to 5 years, eruption will be around 7 to 8 years, root completion will be about when the reaches about the 10 years, okay. So mnemonic, how you will be remembering this classification is, so baby called at 3, crowned at 5, entered at 7, rooted at 10. So basically class calcification occur in the third month, crown preparation, crown completion occur in the fifth, then eruption will be what is the tooth will erupt 7 to 8 months, 8 years, sorry. Then the root completion will be 10 years. So it is like baby called at 3, crowned at 5, entered at 7, rooted at 10, okay. This is how you should remember, okay. So now here I'll tell you how, what is axis, how you have to access when you open the, when you are doing the root canal, okay. Like axis cavity should be in triangular outline, okay. So here you can triangular outline you have to maintain, okay. So centered of the palatal surface, okay. This is how this is a single rooted tooth, okay. So this is how the pulp chamber will look like, okay. So here you can see in the radiograph also how the, when you take a radiograph of a central incisor, how you can, what all you can see. Here you can see the pulp on, incisal edge, distal, mesial, you can appreciate it, okay. Thank you for this seeing this video, and if any doubt you can comment down below. We'll be coming back with more videos, stay tuned. If you like this video, please like, share and comment, and subscribe my channel. Thank you.